So thrilled to have Dr. Daniel Kremens here, who is an esteemed neurologist with a global reputation in movement disorders. He's had a wonderful career, mostly at Thomas Jefferson University. He actually has a very unique background where he has a JD and an MD, which maybe we'll talk about. That's very interesting. And importantly, he's the director of the Optimal Brain Program at the Marcus Institute of Integrative Health. And I'd love for you to tell us a little bit more about that program, Dr. Kremens.
You know, I think the Optimal Brain Health Program at the Marcus Center is really an exciting new way to approach brain health. I think too much time is spent treating disease rather than trying to prevent it. And we know now, particularly with dementia, there's so much evidence building that dementia, if not preventable, can certainly be delayed. Recent data suggests that up to 40% of dementia could be delayed if just simple steps were taken. But the key to taking those steps is to get assessment. And no one really is doing assessment. And that's the real difference at the Optimal Brain Health Program. We do assessment in one day with a group of experts in doing this. And therefore, the patient doesn't have to go from center to center to center, getting mixed up, having to tell their story a million times, getting imaging here, getting their physical therapy assessment here, getting their neurological assessment at a different center. We do it all in one day. And I think that's one of the things that makes us unique. It reduces those barriers to getting assessment, because if a person has to go to multiple appointments at different centers, ultimately they're going to give up, or they're not going to be able to access it in the first place. And the other unique feature that we have is that once we've done that all in one place, we can then sit down as a group and at one time present our findings to the patient and give them a plan that they can then go forward. And these are plans that are generally pretty easy to enact for patients. So they can take affirmative, positive steps to enhance their brain health.
That sounds great. Tell us a little more what that day looks like when they come in for this comprehensive assessment.
Sure. So the first thing that we do is we try to gather records beforehand so that when we're meeting the patient, we already know a fair amount about them. The other thing that we do that's not done that day is we get labs beforehand. That way, when we're meeting the patient, we have a pretty good idea of at least their lab profile as well. And we review all this before we meet with the patient. In addition, we have them fill out a pretty comprehensive intake form that as a team, we review and make a decision. Do we think that this patient will benefit from our program? So there's lots of input that's going in even before the patient shows up. Once the patient shows up, they undergo a functional imaging. So we're probably unique in terms of the brain assessment world in that we have a PET-MRI, and every patient gets functional imaging. That's the first thing they do when they get here. We're one of, I think, only 32 centers in the United States that has PET-MRI. And
what kinds of things does the PET-MRI show?
So this is the great thing. A lot of people, when they're getting their brain assessment, may get an MRI. Mm-hmm. And an MRI is a great study, but the problem is it's only really looking at structure. And what a PET scan allows us to do is add on a layer where we can now look at function of the brain as well. We can see which parts of the brain are active, and by looking at that, we can combine the structural elements of the brain with what we see functionally. And certain patterns of function may lead us to think about what problems this patient is having. Are there problems related to the fact that they've had concussions that we may not be able to see on the MRI, but we can see with the PET scan? Could it be that they have some underlying dementing process early on? And we may see some of that on an MRI, but typically that shows up on the MRI later. But we may see earlier signs of that we can intervene on with the PET scan. So being able to get that functional component makes a real difference in the assessment.
Great. So there's this imaging, the labs. What else goes into the assessment?
Right. So then the next part of the assessment, there's a number of parts. So they will meet with a occupational therapist and get a cognitive assessment with the occupational therapist. They meet with a psychologist who specializes in biofeedback and does an assessment looking at how that particular patient reacts to stress. They do assessments, for example, of muscle tension. We do a complete physical screening looking at things such as hearing, which, recent data suggests that hearing may actually be the biggest single intervention we can do to impact dementia. So if we're picking up hearing loss that the patient hasn't picked up, and then we can get the patient appropriate further screening for hearing loss, that's a really simple intervention that you can do that can literally decrease or potentially even in some patients prevent dementia. The patient then meets with us as a team and tells their story to all of us at once. That way the patient's not forced to repeat their story over and over and over to each different person they meet. And one of the aspects that we consider important when assessing brain health is looking at stress and things such as trauma, right? And the ability to just have to tell your story one time, again, is something really, I think it's unique to us, because for a lot of these patients, they have had significant traumas. We've seen a fair number of Navy SEALs. And, it's very, very difficult for those folks to have to share traumatic experiences multiple times over the course of the day. So we're able to do that all at once. And the other nice thing about that is that as a group, we then have the opportunity to ask questions. For example, I may have certain questions as a neurologist that I think are more important, but then occupational therapists with a psychologist may also want to get their questions in at that time. So we can really get a much broader approach when taking the patient's history than the patient would get in a traditional medical setting. The patient then undergoes a thorough neurological exam with me. And again, there's some further cognitive assessment during that part of the day. So it really is a very, very comprehensive program.
What kinds of patients seek out this type of assessment?
I like to say motivated patients seek out this type of assessment. So it honestly, it can be anybody. And we've seen a wide range of patients. Some patients are people who have a family history of dementia. They've seen what happened to their parents and they're concerned. Other people may be people who are very successful at work, but don't feel as sharp as they were and are looking to see, is there anything they can do to maintain their skills or to get an edge. Other people are people who've had some sort of trauma, either a professional athlete, for example, or someone who's had a number of concussions.
Like the Navy SEALs.
Indeed. And then we've seen a lot of military folks who've had both physical and often emotional trauma that is impacting their cognitive ability and their ability to function optimally.
Can you think of a patient you've had through this program that really benefited from the experience of having had the assessment?
We've seen a number of folks. I recently saw a patient, a person who was in their later 70s, who just didn't feel as sharp as she should be. And on the first assessment, she had wonderful social skills. I thought that, she's going to do fine. But our assessment actually did demonstrate that she was having some signs of early dementia. And her imaging demonstrated hypoactivity in areas of the brain associated with cognition, in particular her temporal and parietal lobes. And then further cognitive testing that we did demonstrated that she wasn't doing as well as we would have expected. But because she had such wonderful intact social skills, this person had been able to get by and sort of fool people around her. But she knew herself something wasn't right. And so the good news for her was that we were able to give her substantive interventions that she could do in terms of changing her diet, decreasing her cardiovascular risks, which are strongly associated with an increased risk of dementia, addressing blood glucose, which again, diabetes is certainly a risk for dementia in the future, addressing sleep, which was a major problem. Sleep is when we integrate our memories, and people who sleep poorly may have worsening cognition as a result. And then other things that people wouldn't even begin to consider, but there's increasing data now that things such as air pollution actually impacts your risk of dementia. So making simple recommendations such as getting a home air purifier, limiting your exercise when there are air advisory warnings, not going out for your walks by areas high in air pollution like car parks and things like that. And these things can make a real difference for people. And so I know that, first of all, it gave her a real insight into herself that she wasn't crazy. She actually was having some problems, even if everybody else was dismissing them. And it gave her a path to start now addressing them in ways that were more palatable to her than just simply taking another pill.
Yeah, great. How about maybe one of the younger concussive patients?
And then in addition, we've seen a number of some younger folks as well who feel that they weren't performing optimally, in particular, some of the ex-military folks. One gentleman in particular who felt that he just wasn't functioning as well at work. And again, when we did a deeper dive into his history, he had a number of concussions, and his PET-MRI imaging confirmed that, in fact, this particular person did have some underlying signs in his functional imaging that, the concussions had impacted things. So, and in addition, his history demonstrated that he had some unaddressed emotional challenges related to his combat. And having the opportunity to discuss that and talking about some strategies to address that, I think were very helpful. In addition, these things were really impacting his sleep, which again was impacting cognition and his ability to perform. And so we were able to come up to some strategies to help him address his sleep in a very proactive way. Most of these folks in this group are already doing a really great job with their exercise, but we looked at some issues with diet that we thought were addressable. A lot of folks who have been through trauma often self-medicate with alcohol and sometimes other drugs, and having the opportunity to review that and discuss it with the patient and how this is potentially impacting their cognition as well as their emotional state and their sleep, and address it, or at least give them the opportunity to consider that it's having an impact when in the past they may have dismissed it. And so these are just some relatively simple interventions that you can make, but you got to get the assessment.
So what are one or two things you'd want the average person out there to know who might be having some concerns, might have had some head trauma or is experiencing some cognitive decline?
I think in an ideal world, I would say get an assessment. Right now, that may be challenging for some people because unfortunately, the way our health system is set up right now, we really don't pay for preventive care like this, so insurance typically is not going to cover a program like ours. But for those people who can access it, I would say if you're suspecting that something's going on, you should get an assessment, because as I mentioned earlier, we're now learning more and more and more that we can do things to intervene and potentially prevent the progression of dementia. And the earlier you address these issues, the better the outcomes are going to be.
What's something that somebody could ask their doctor for that maybe the doctor wouldn't otherwise want? Is there something?
Sure. I would say that the one thing that I would recommend that people ask their primary care doctor, particularly if they're a little on the older side, is a recommendation for a formal hearing assessment. We have more and more data that this is probably the simplest intervention and the most impactful intervention we can do to prevent or delay dementia. If the brain isn't getting adequate input, and much of that input is coming through our sense of hearing, it's going to atrophy, and we're not using it. And hearing aids can make an enormous difference. Also, we know that socialization is key, and people who are experiencing hearing loss self-isolate because they don't hear people. People get frustrated speaking with them, so they stop speaking with them. And it's such a simple intervention that could potentially delay or prevent dementia.
Top 3 preventive things people could be doing to stave off cognitive decline.
Number 1, adopt a Mediterranean diet. So we have lots and lots of data to suggest that the Mediterranean diet is great, not just for the brain, but for the heart. And what we know, what's good for the heart is good for the brain. That would be number one. Number two, exercise. Common sense, but what's good for the heart is good for the brain. Any sort of exercise you will do is great, but probably an exercise that emphasizes cardiovascular exercise is probably going to be the best for your brain health. And probably number three is socialize. It is so critical. We see so much more dementia in people who are isolated. And the great thing is that so many of these things can be done together, right? You can get together with some friends, go out for a great walk, and then come home and have this wonderful Italian Mediterranean meal with maybe a little bit of wine. People think, oh, it's so hard to do all this stuff, but it's really not. These are things that you can incorporate into your lifestyle really pretty easily, and they can, over time, make changes that can lead to better brain health.
What about the future of this field of brain health excites you?
We now have a term, preventive neurology, right? And we never spoke that way before because we viewed things like this as an inevitable part of aging, or there's nothing we can do about it, and there's a whole sense of therapeutic nihilism in particular because, until recently, the pharmacological therapeutics have not been very promising. And although we have seen some movement on that front, the newer drugs are still very controversial, and there may be some risks involved with those. But we're learning now that there's just things that we can do outside of that. Some of the stuff I've talked about before, lifestyle changes, dietary changes, addressing issues regarding stress and isolation, sleep problems. And what this is like, it's a different way of thinking. We've never thought about intervening. And now we know that there are at least 12 factors that are modifiable risk factors for dementia that we can address. And that's really a shift in the way that we're thinking. And I think this notion of preventive neurology is going to become more and more accepted as time passes and we develop more of the data to show if you do these things now, you can prevent or delay dementia later.
I love the hopeful, positive approach. Thanks for the great conversation.
Thanks, Dan.